Welcome back! Let's get started with our exciting course on EMDR therapy by discussing what it is and how it works. EMDR is a form of talk therapy that falls under the umbrella of psychotherapy. Let's quickly review the history of talk therapy. For many years, there was a stigma around receiving mental health treatment. Many people who needed help didn't go to therapy out of fear of being labeled crazy or weird. The general public didn't understand mental illness. Sometimes they thought their loved ones were seeking attention or weren't being grateful for their lives when they were actually struggling with mental problems that went much, much deeper. This lack of understanding about mental illness caused many people to suffer and their conditions to worsen since they couldn't receive the help that they needed. This has happened since ancient times, with many ancient societies viewing mental health issues as witchcraft instead of actual disorders. But that all changed in the 1800s when psychology emerged as a scientific study. The field continued to grow until in the 1960s, psychology and psychiatry were accepted as the standard treatments for mental health patients. During this time, psychotherapy or talk therapy emerged as a technique that helps patients overcome their emotional, psychological, and behavioral challenges. Different types of psychotherapy are used for different mental conditions. One prominent type of psychotherapy is EMDR. EMDR stands for eye movement desensitization and reprocessing. It is also known as EMDR talk therapy. This treatment is primarily used for patients with post-traumatic stress disorder, or PTSD for short. However, EMDR is constantly evolving. New research suggests it may be effective for other disorders such as depression and anxiety. EMDR is a structured therapy that encourages patients to focus on their traumatic memories for a brief period while simultaneously experiencing bilateral stimulation, which is when a stimulus is presented on both sides of the body to activate the left and right hemispheres of the brain. Typically, the stimulus is something patients look at, making their eyes move from left to right. This technique desensitizes the patient to their traumatic memories, allowing their brains to reprocess their experiences so they don't cause as much pain. This was just a quick overview of how EMDR therapy works. Don't worry, we'll discuss the exact techniques and methodologies of EMDR treatment later in the course. Well, that concludes our video. Thanks for joining me, and I'll see you in the next one.